Hello mothers and mothers-to-be, welcome to our podcast where we will talk about the Tdap vaccination, the loving protection from mama to baby. Joining us today is a Professor Datuk Dr. Zulkifli Ismail, a consultant pediatrician and the technical chairman of Immunize for Life. And the next to him is a Professor Dr. Jamiyah Hassan, a consultant obstetrician and gynecologist and Fetomaternal specialist from UiTM Shah Alam. She is also the chairperson of Maternal Immunisation Guidelines and the past president of Perinatal Society Malaysia. Welcome to this podcast today.
Thank you.
Good news for all expectant mothers. Starting in 2025, the Ministry of Health has begun offering the Tdap vaccination to all pregnant women. Perhaps Professor Datuk Dr. Zulkifli could explain more about this initiative, including how it works and what expectant mothers need to know.
Thank you.
Welcome.
For the first time, the Ministry of Health is giving the Tdap vaccine to all mothers free of charge at the gestation period of 28 to 32 weeks. And any mother can go to a clinic, a government clinic, and get the vaccine, but she needs to get it every time she's pregnant.
Okay, we go back to Professor Dr. Jamiyah. When it comes to the recommended timing for the Tdap vaccination during pregnancy, Professor, we understand that is generally advised between 28 weeks and 32 weeks. Professor, is there any flexibility in this window? Can mothers receive the Tdap vaccination earlier than 28 weeks or later beyond 32 weeks?
The Tdap vaccine can be given earlier than 28 to 32 weeks. So if you look at the guidelines around the world, it starts to be given Tdap vaccine from 16 weeks. Most guidelines are either 16 or 20 weeks up to 36 weeks. So if you look at the original CDC guidelines, say from 27 weeks to 36 weeks. But in Ministry of Health is a policy. So they want to give the Tdap vaccine from 28 weeks to 32 weeks. It does not mean that if the patient come at 33 weeks or 34 weeks, they may not give the vaccine. But because it was just being rolled out, so at the moment, they're giving the vaccine from 28 to 32 weeks. But the vaccine has been shown to be effective and safe, even if it be given much earlier than that.
So what happens if the mother take early 20, maybe 60 weeks also not?
It's the same. So when the mom is given the Tdap vaccine, so the premise is the mother will need antibodies. So these antibodies will be passed through the fetus in the womb through the placenta. And then the baby will get the maternal antibody. And when the baby is born, so there's passive antibody from the mom, and it will protect them against a vaccine protected disease. So like this one, we're talking about pertussis, to protect the baby right from the first breath and the first 3 months when the baby is still vulnerable, because the vaccine for the baby from Tdap, which is quite similar, Tdap is diphtheria, tetanus, pertussis, will be given from 2 months onward. 2 months, 3 months, and 5 months. Be completed only 5 months. So the baby is not fully completed until the complete series. So the maternal antibody will protect the baby before their primary series.
All right, thank you, Professor. Okay, Datuk, we know that some expectant mothers today choose to receive their antenatal care at private facilities. However, when it comes to important maternal vaccinations like Tdap, could you clarify whether mothers who attend private facilities are still eligible to receive their Tdap vaccination at the government clinic kesihatan like KK, and what would be the proper procedure for them to do so?
I think the all mothers are allowed to accept to get the vaccine from all of the government clinics, clinic kesihatan, and they have to register with the clinic to get it. Either they register physically there. I think they can also use MySejahtera and register. And once they've registered, they will be on the list, and they just request for the vaccine, and they should be given. It will be given during that time phase of gestation. But then if they are before or after, they should still be given the vaccine.
So they have no problem either you go to the KK or the swasta. There's no issue, right?
No,
Have
they
you-
do, yeah.
everyone
You can
can
go
get
to KK.
All right.
You can get from KK.
Okay, next to Professor Dr. Jamiyah. Before we go further, I think many mothers out there would first like to understand the basics. Professor, could you explain what the Tdap vaccine is and why it is very important, especially during pregnancy?
Well, only the mother can protect the fetus, we say. So that's why it's very important. But the mother is exposed to a lot of infection. And therefore, and the babies can be exposed when the baby is born. Now, vaccine have been shown to protect. So in Tdap vaccine, so T stands for tetanus, then D in diphtheria, and pertussis, that pertussis. And it's much easier for them to get pertussis from anyone. So therefore, it's very important the mom to protect themselves. But for Tdap vaccine, the main objective, the goal, is sexual protection of the fetus and the newborn. So the mom, if they get pertussis, they will just have cough, like Datuk will say, just prolonged cough. You may not know they have pertussis. But if the fetus has pertussis, they can't even breathe sometimes. So therefore, when you give the mother vaccine, the Tdap vaccine, so it will mount antibody, and this antibody, as I said just now, will be transferred to the fetus, and they'll protect against this vaccine-preventable diseases. In this one is tetanus, diphtheria, and pertussis mainly, because that's very important before the baby can get the primary series. Because this infection is very dangerous to the babies, especially when they're newborn in the first 3 months and they haven't got their own primary series of vaccine.
All right. When we talk about to get immunized Tdap to the mothers, what happened to babies and mothers who don't want to take any vaccine?
Well, if the mother do not want to take the vaccine, they can get infection from pertussis, let's say. So they acquire the infection from another person and they have pertussis.
Yeah.
But they mount an antibody, but that antibody is not high enough to be transferred through placenta. So it cannot protect the baby. But vaccine mounted high antibody. So they can protect themselves. They can't protect the baby if they don't take the vaccine.
Yeah, okay. We go back to the Professor Dr. Zulkifli. Why do you think the Minister of Health, MOH, has decided to introduce or push for this vaccination at this particular time? It is because of recent data, rising cases, global recommendation. Can Doctor explain?
Yeah, it's a combination of all of that. Right now, as Prof. Jamiyah said, it's tetanus, diphtheria, and pertussis. These are the 3 diseases. And the data shows that pertussis has actually increased in the country. The Ministry of Health data shows that in, say, 2011, there were about 248 cases of pertussis, yeah? But in 2023, it's gone up to more than 1,200. So that's about 8-fold increase in cases. In 2023 also, the data from the Ministry of Health showed that there were 43 deaths. And 1/3 of that 43 actually occurred in those less than 5 months old before they have received their first doses of vaccination for the babies. So because of that and because of the high mortality deaths, so the ministry decided that this is the best option to help mothers to prevent the babies from getting infected.